Hi everybody, my name is Kimberly Bean. Today I'm going to be talking to you about the effects of pharmaceuticals in our ecosystem. I just wanted you aware of what is going on in our environment. Effluents from sewage treatment plants often contain low levels of prescription and over-the-counter drugs. Several studies have determined that flush drugs that have entered certain waterways, like lakes and streams, have revealed intersex fish, deformed frogs, and possible links to neurological problems in children. Flush pharmaceuticals are increasingly being detected in our lakes and rivers, as stated by Elizabeth LaPlante, Senior Manager for the EPA. She states, as leftover and waste pharmaceuticals get flushed down drains, research is showing that they are increasingly being detected in our lakes and rivers at levels that could be causing harm to our environment and ecosystem.
We know this.
Pharmaceutical products are designed to cure and treat disease and to help people be healthy. However, like many foods and nutritional supplements, they are not always completely absorbed or broken down by the body. Pharmaceuticals have become a considerable source of environmental contamination. Drugs of all types enter our water supply when they are excreted or improperly disposed of. The health impact of long-term exposure to varied mixtures of these compounds is unknown. Numerous reports have shown that drugs and drug residue that ends up in our water supplies typically isn't filtered out by municipal treatment plants. In fact, up to 80% of drugs taken by humans and domesticated animals can be excreted in their biologically active form. So medicines enter our environment in two ways. One, excretion from our bodies. Humans and animals pass drugs or drug metabolites through their bodies, and then these chemicals pass through our septic systems or wastewater treatment plants. Wastewater treatment systems cannot effectively remove all medicines, and some are discharged to surface waters or are collected in biosolids that are often applied to land. Number two, direct disposal to sewers or trash. Medicines can enter the environment when flushed down toilets or sinks because they are not effectively removed or degraded by septic systems or wastewater treatment processes. Medicines thrown in the trash retain their biological and chemical activity and may eventually end up in the environment. Our conventional wastewater treatment systems were not designed to remove or destroy pharmaceuticals. No single treatment process will completely remove all the thousands of different pharmaceutical compounds. The presence of these pharmaceuticals in our environment depends upon their individual chemical structure and the magnitude of their use. There have been many water quality assessments done in various lakes, rivers, streams, and other waterways across the U.S. And there's been a number of detected pharmaceutical compounds in these waterways. Acetaminophen, antihistamines, antibiotics, antidepressants, codeine, diabetes medicines, HRTs, which are hormone replacement therapies, asthma medications, sedatives, and the list goes on. Scientists have discovered a range of adverse effects in wildlife exposed to pharmaceuticals. For example, freshwater habitats around the world have been found contaminated with the synthetic estrogen used in contraceptive pills. A large body of evidence has connected this contamination with excess feminization in fish. U.S. and Canadian governments purposely contaminated an experimental lake in Ontario with estrogen used in birth control pills and studied the effects on the lake's fathead minnow population, the common species that fish like lake trout and northern pike feed on. Minnows normally become sexually mature at 2 years of age and enjoy a single mating season before perishing. Exposed to estrogen, the male minnows testicular development was arrested, and they started making early-stage eggs instead. That year's mating season was disastrous. Within 2 years, the minnow population crashed. So what this means is certain species of male fish were carrying immature eggs in their testes. Environmental studies have also found that male frogs are developing eggs in their reproductive tracts. The discovery of deformed frogs are causing international alarm. Frogs are seen as the pH paper of the environment, and their deformities may reflect a poisoned environment. The types of deformities found in the frogs range from the absence of limbs, extra limbs where they shouldn't be, fused feet and legs, excessive skin, and missing or misplaced eyes, including an eye that was found growing in a frog's throat. Ecologists are currently investigating the possibility of synthetic estrogens in the waterways as the culprit to these deformities. This brings up the scary possibility that whatever is poisoning the frogs may be poisoning humans too. And I have brought in a diagram. There's some deformed frogs here that their legs are fused together, and they're actually missing some legs here. So, tainted waters have been linked to neurological problems in children. Since children's bodies are less developed and incapable of detoxifying certain compounds, they are easily affected due to the system sensitivity still developing. Children, babies, and toddlers, as well as fetuses, are more susceptible to environmental exposures because their bodies are still developing and their exposure on a pound-per-pound basis is higher, and they lack the detoxification system adults have. So it is not unreasonable to expect they would be at a higher risk. Exposure to even very low levels of toxic chemicals in childhood years has been linked to increased risk of degenerative disease in later years. Childhood asthma, cancer, leukemia, and immune disorders have all risen in the last decade. Many experts suggest that this is due to children's increased exposure to environmental toxins and their decreased ability to detox. Water plays a major role in a child's exposure to pollutants and their drug's ability to get rid of them, or their body's ability to get rid of them, A child consumes 3 times as much water per pound of body weight than an adult does. So children get a bigger dose of the chemicals in our water, and their developing bodies are simply much more sensitive. So in conclusion, our use of man-made chemicals has become so extreme that we can find traces of low-level toxins in virtually every public water supply in the world. This contamination is poised to worsen as the global appetite for medication swells with an aging population and cheaper manufacturing. Pharmaceutical production is expected to grow 4 to 7% annually until at least 2013. Drugging our bodies inevitably drugs our environment too, as many medications can pass through our bodies and waste treatment facilities virtually intact. And it is difficult to predict where and how unexpectedly vulnerable creatures may accrue potentially toxic doses. There's no doubt about it. Pharmaceuticals are being detected in the environment, and there is genuine concern that these compounds, in small concentrations that they're at, could be causing impacts to human health or wildlife. The human body is over 70% water. It's a common sense equation that the quality of the water we drink will have a major impact on our health. So in that respect, what can we do to prevent further harm? Well, people need to be educated on how to properly dispose of unused and unwanted drugs, and to put a halt to tainting our waterways. Thank you.
That was 5 minutes. All right. That is very interesting, Tim. And how do you
And I
dispose
kept
of